I can go ahead and start.
Okay.
Good evening, ladies and gentlemen. I'd like to call this meeting to order. First order of business we have is the Pledge of Allegiance, so if you please stand and repeat after me.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Next, we need approval of the agenda.
I would make a motion that we approve the agenda as published.
Second.
To move and second, we approve the agenda as published. Any further discussion? All those in favor of the motion, please say aye.
Aye.
Aye, that motion carries. Thank you. Next, we have public comment. This time, public comment was accepted by an email on a first-come, first-served basis to the clerk of the board. And we have those comments now, and I'll turn this over to the clerk of the board to read the public comments.
Okay, just so for the board's information, I did receive 5 total and 1 was rescinded. So I will just start with the ones that were received. My name is Sherry Tilford. I live in Sandpoint. My daughter is homeschooled and attends the Homeschool Academy. I would like to point out some of the propaganda that is driving this supposed pandemic. It's a new virus. No, it's not. There is not one bit of proof or evidence that there is any new virus here. Masks help reduce the spread. No, they don't. Unequivocally and undeniably, no, they do not. The dangers of mask wearing have been talked about ad nauseum by several parents at past board meetings, and citations have been provided to the board backing up the stated claims. Masks are nothing more than fear muzzles. Quarantining healthy individuals will help reduce transmission. The evidence in our own community blows that right out of the water. Never in history have healthy people quarantined. This is about controlling the people, not controlling a virus. Case numbers are up. At the risk of sounding callous, who cares? Thanks to the tests being useless as diagnostic tools, case numbers are in no way a reflection of actual sick people. Death numbers are not up. Questions have been asked in previous board meetings about when this will end, and the answers have not been given. I have 3 questions I would like the board to answer at the next meeting. 1, why are you continuing to require masks when you have been given a mountain of evidence showing that they are not only ineffective but potentially hazardous? 2, what is the end game here, and when will you stop allowing propaganda and provably fraudulent information to guide your policies? 3, why are you following the governor's mandate rather than standing up for the truth? The lies are easy to find if you look behind the mainstream curtain. There is no excuse for buying what they're selling on the news when there are damning consequences to our children and our community. I will happily provide many more mountains of evidence to support my assertions that all the policies of anti-social distancing, masks, and health quarantining are pure superstition and public control measures. Thank you in advance for answering my 3 questions.
Thank you.
So I'll just move on to the next one. Good evening. My name is Kathy Keys, and we have had our children in the Lake Pondere School District for the past 10 years. We are grateful for the opportunities the district has provided over years and for the willingness of each school board member to be elected by our community and work with parents to give our students the best education possible, not only in regards to academics, but also in the realms of social, trades, and athletic opportunities. I am writing to ask that the board members take a serious look at the current policies regarding quarantining healthy children based on the sole reasoning of their desk unfortunately being less than 6 feet apart for more than 15 minutes. This has taken a toll on our children, not only in their studies, but the emotional and mental health of our kids has been immensely affected. Our children sit in a class and wonder, who's next? When the principal walks in. When given the option of being tested in order to return, they say no because they know the potential false positives. In the words of my son, I don't want anyone else to be punished just because they sat next to me. I ask specifically that you lift this current restriction and allow the individual parents the option of whether to keep their healthy children home. Please look at the fact that thousands of us have chosen the option of sending our children physically to school. We understand and have researched and the recovery rate pertaining specifically to COVID-19 and have felt comfortable with sending our children to school. My husband and I have buried a child. The lives and health of our own children is not something we take lightly, and we hope that each one of you support parents capable of discerning what is and what is not a safe environment for their child. If a child tests positive and is within 6 feet of my child, why not give us the option of whether to quarantine or not? I have never once in the 19 years of being a parent asked a school district to weigh on the health of my children, and I don't plan on beginning to do that now. Ironically enough, last year I kept one of my children home for quite some time as he was very ill, and I would not send him to school to infect others or other kids. I was sent a truancy letter. Please respect the fact that we are quite capable of evaluating when to keep our sick children home and send our healthy children to school. This is not an easy position for you as board members to be in, as we know that there are differences of positions and you can't please everyone. I just ask that you please look at the rooms filled with children and understand that we as parents have weighed our options and risk and still have chosen that they be there to be welcomed there without fear of unnecessary quarantining. I wanted to add that my son is a senior at the high school in Welding 3, and because of this great program, he will be pursuing his training as a pipeline welder after graduation. He is also in a math class and sits next to a student whose parents exercise their right in getting their child tested for COVID-19. And as a result of their being able to have this right, we lost our rights as parents to send our healthy child to school, and he is not able to continue welding studies online. Please take these situations into consideration. I appreciate you. Merry Christmas to each of you.
Thank you.
Right.
More?
Yes, there are two more. To who it may concern, addressed to all of you board members.
And who is this one?
This is Brian Lorenzen Popawala. Typically, I am polite and well-mannered. However, politeness and facts no longer work with those that falsely believe and spread the propaganda which is being pushed on the American public. I am sure that you might have meant well deciding to serve on the board. And of course, none of us saw this pandemic coming. Now we are in an emergency. The emergency is not a pandemic. The emergency is the outright destruction of our rights by those in various levels of power. A bit of background on myself. I'm a third-generation owner and operator of 2 funeral homes in a metropolitan area. At the beginning, we prepared for mass casualty event, not knowing the full extent of this sickness as we watched in horror people dying in the streets of China. We willingly agreed to lock down our society and stay home to protect the most vulnerable and not to overload the healthcare system. Nothing happened. COVID-19 was placed on death certificates as a cause of death, even if a person was 95 years old and 425 pounds. It was a joke, a hoax, a nothing event. 9 months later, still people cower behind their masks and shame others for gathering in public. Unless you are rioting or shopping at Walmart, then it is okay. There is zero scientific evidence to show that mask and social distancing do anything to prevent coronavirus. There is zero scientific evidence that SARS-CoV-2 is even a virus. There is zero scientific evidence or validation to show the PCR test is accurate. There is zero scientific evidence that shows there is a global pandemic. There is only fear and propaganda. There is not a significant change in the death rate between 2020 and previous years. If there was a real pandemic, people would be dying at a much higher rate. The survivability of those diagnosed with SARS-CoV-2 is much higher than 99+% than the normal yearly flu. Actually, most people don't even show symptoms. The coronavirus would disappear overnight if people stopped getting tested. Do you remember when the CDC tried to scare us with death rates? Since not enough people are dying, now they are trying to scare us with positive cases. Don't you see this? Is it so obvious once you get it? This propaganda is being pushed in order to control populations and track our movements, push unsafe, untested, deadly vaccinations, permanently take away our freedoms, and as a cover for the global reset. The fact that you, on the board of an educational institution, support mask mandates and social distancing and yet are too ignorant to see through this nonsense shows me that you are, 1, mentally unstable, uneducated, and underqualified for this position during this dangerous time of growing tyranny. 2, you or your school district is receiving a payoffs for enforcing such mandates. And or 3, you are a pervert forcing masks on children and making them submit to torturous melodramas. Either way, you are unfit for serving our community. I demand that you apologize and reverse your decisions around this pandemic or step down from your position. When the smoke clears, you will be remembered as cowards and enemies of the individual health freedoms. Consider who you are working for, fathers and mothers who are protecting their children. If you wish to discuss this further, I will gladly make myself available.
Did this person say they had students in the school district?
No.
Okay.
Thank you.
And then the last one, dear Board of Trustees, my name is Jerry Lewis. I am a 56-year resident of Sable, Idaho. Pat, my wife of 58 years, and I have raised our 4 children and 11 grandchildren here in Bonner County. All 15 of them have been educated in the LPOSD system. We are extremely pleased with their education and the overall results. This brings us to the point of this letter. Pat and I would like to compliment Tom Albertson, our superintendent, and each one of you trustees for doing such a magnificent job on navigating the school district through these uncharted, rough COVID-19 waters. You certainly have not had an instruction book to help guide you, yet you have made your best decisions, primarily taking into consideration the safety and welfare of the students, the faculty, and the staff. It is very comfortable for those of us who don't have to make the hard decisions to post-game quarterback, what you should have done or not done. It is easy to criticize, but harder to compliment. In our opinion, you have needed to make some rules to maintain the safety, but what we are most impressed with is that your decisions primarily pertain to common sense. Social distancing, personal and object sanitizing, and face masks just make sense. I believe you can count on the majority of parents and grandparents to use our common sense and do the right things for the safety and welfare of our children. Thank you for all the time and effort you dedicated to our students, faculty, and staff. Congratulations on a job well done. Signed, Pat and Jerry Lewis.
Thank you. That's it? Thank you.
Yes.
Need more water?
Did a very good job.
Thank you. Okay.
With the public comment over, we'll go ahead and move on to information items. First, we have under administration, the staff recognition, and I'll turn that over to our superintendent to do that.
Yeah, thank you, Chair Kelly. So tonight, we'd like to recognize the whole Transportation Department and their director, James Kaler. So James, thank you for being here with us tonight. I want to recognize the dedication that the Transportation Department has shown during these difficult times. I do want to recognize tonight Tommy Lund, who did pass away just recently, one of our drivers who was very well respected within the department and loved by the children that he drove. He drove the route going to Schweitzer. You know, it has taken its toll on the department, and rightfully so. Through that, I do want to just, I can't say how much I appreciate their professionalism, dedication, and through the leadership of James. So, James, I just want to say thank you, and I know there's not enough words tonight that I could even say to your department, but I do want a heartfelt thank you to them. For getting the children to school safely, and I know this is one of the most challenging years for your department. So, thank you. Anyway, thank you for being here, and we have a
Do you have any words? Do you have any words for us?
I mean, all the credit goes to my team. They are an amazing group of individuals that come in every single day and put their hearts and souls into that job. And so, if it wasn't for that incredible team, they're just amazing people.
I have to agree. Here's a hand for the bus drivers.
I'm going to give you this certificate of recognition, and I'll withhold shaking your hand
Yes.
just because of the environment.
Thank you.
Thank you so much.
Thank you, James.
Thank you.
Thank you.
Thanks.
I talked to James a little bit earlier before the meeting started, and I told him I realize how difficult it is to have a job like this where you're working from day to day, not knowing quite exactly how many children you're going to have, what the routes are going to be, how many drivers you have. But he's pulled it through and just done a fantastic job. So just let me add that on to what the superintendent said. Thank you very much, James.
Thank you.
Okay, next we have a school presentation, Polk Elementary School, and Principal Shirley Hatley is with us. Nice to see you.
Good evening, everyone. I'd like to say thank you very much for this opportunity to present. I'll start first with celebrations out of Hope School. So I believe in the two presentations you've heard already about MAP data from the middle school and as well as Clark Fork. But I think, and you'll continue to hear this, but with ELA on our MAP data, fall to fall, even with COVID happening and shutting down schools in March, our kids still really did fairly well. And as a matter of fact, in third grade, fourth grade, fifth grade, and sixth grade, our MAP data showed that they still met their growth expectations. And in some cases, exceeded those growth expectations for a full school year, even though we didn't really have a full school year.
Mm-hmm.
First grade and second grade, that would be our kindergartners moving into first grade, so currently first grade, and then first grade moving into second grade. Those were the kiddos that were really hit the hardest. If you think about what they're learning towards the end of kindergarten and the end of first grade, they're really solidifying their reading knowledge and not having that practice, not to beat that path as much as they would have as if they were in school. So it's like the weeds grew over their path a little bit more so. And so that will be one of our focus for this year. Our main area of focus, and you'll hear this district-wide also, is math. And at Hope School, we really do love math. We focus on our attitude and our mindset about math constantly. more specifically in the areas of algebraic operations and algebraic thinking for the K-5 level, and then at the 6th grade level, that probability and statistics are really our area of focus. Our data shows that we could do a little better in those particular areas. Some of our strategies that we'll use to do that, we're utilizing Imagine Math, the math facts, and then also teachers can set specific pathways individually for students within Imagine Math so that when they work independently on their Chromebooks, that like if my weakness might be geometry, I can set a path, my teacher can set a path directly for me, so then that's my area of focus when maybe I won't need to work on something that someone else, one of my classmates needs to work on. So it's very individualized. Another aspect is looking at that academic language, and that might be the language of analyzing, compare and contrast. And do our students really understand what it means to analyze or to compare and contrast? And then also the math content vocabulary. When we pose a problem to a student, they may realize that they have to find the average, but if the question asks not utilizing the word average and they say find the mean, if our students don't know that particular content vocabulary, they might be able to do the calculations perfectly fine, but they're not really sure what the question's asking them. So really solidifying and making sure that that academic language as well as the math content language is very important to us. Interim assessment blocks. So in grades 3 through 6, these are the shorter assessments that we can use that support the ISAT assessment. And we can offer several of them throughout the year. They're about 14, 15 questions, but they're very, very specific. So a teacher might offer base 10 numbers to her 4th grade students, and then those students will get very specific questions all around that base 10 assessments, and they know, oh, I've got this down. I feel really solid with this, or oh, there's 1 or 2 areas where I can grow a little bit more. So there's snapshots throughout the school year that a teacher can offer their students. And I love our approach with our interim assessments because our students don't dread taking them anymore. You know, probably the first couple years we utilized them, it was like, oh, more assessments, I don't want this. But, and no joke, I would not tell you, I would not make up this story, but yesterday I'm in a 4th grade classroom and I was subbing as the music teacher. And one of the students says to me, Mrs. Hatley, I can't wait till I take my next IAB. I'm so excited. I want to see how much I've learned in the last month. And I mean, and he's dead serious. And I just love that attitude of the approach about taking these particular kind of tests, because my teachers have worked really hard in showing the students that this test helps both you and I know what you know, so then we can better focus on the parts that you don't know. And they really do, they look at that. They look at it as, okay, I want to know what I know. And they work really hard. And then when they get their results back on those assessments, the teachers dissect it with the students. So then they are using it to inform their instruction. They're taking it apart and really addressing. It's not like, I mean, I don't know if you ever got a test back where you're like, yep, I missed that one, but I don't really know why. These kids know exactly, by the time they dissect it, they know exactly why they missed it. And sometimes it's a silly mistake and they're like, oh, I totally understand now. So I do think it's kind of weird that we're so excited about assessments, but it really is the case. And then, and so with that comes that student ownership of learning and goal setting. And Hope, for many, many years, has been very focused on our individual learning goals for students and having them take ownership of it, and they monitor their progress on those goals. So it's not a goal, you know, we've probably all had times in our lives where we have a goal and, oh yeah, I kind of forgot I had that goal. I said I was going to do that. And then, but these kids don't. They're monitoring it on a regular basis. Some of them have visuals, they call them brain graphs. Others are looking at their data from online and going, oh, okay, yeah, I am moving along. So age-appropriate measurements for that. Then specifically, kind of what makes Hope Hope? Really, culture of connection and our family engagement and just learning that we love to learn, we love to be connected with our small, tight community, but we feel that we're very welcoming and encouraging to new families that come to us. We want to rope them in right away and make sure that they feel a part of us and they feel comfortable asking questions if they don't understand something. Some of the things that we do are Kindness Wednesdays. We encourage not only just to be kindness, but also to have a visual. And so we wear pink or red on Fridays. I've got some boys that were like, I'm not wearing pink. And we're like, okay, wear red. And then I've got other boys that are like, see my new pink shirt? And so they love it. And they're like, yeah, Kindness Wednesday. School Pipe Fridays. I know a lot of schools wear their school t-shirts or sweatshirts on Fridays, and it just shows that connection with one another. And you know, in a different year, you could walk down the hallway and see all grade levels in their Friday regalia. Now you can just walk into a classroom and you see it on, you know, each individual grade level. Even if they're not wearing the Hope School Wildcat t-shirt, a lot of times they're wearing green. So there are ways to definitely be part of it and not have to be any added expenses or anything like that. We also are kind of known for our family nights. Right now we are not really having family nights, but we're still engaging with our community and reaching out to them and finding ways within Google Classroom. Teachers are posting videos or pictures of the little ones in Google Classroom so parents can log in and still feel like they're connected to the school, as well as sharing those videos class to class. Like we share them like very much like a slide like this, and I'll talk about that on the next one, but I put a link in, and so if the second graders do something celebration wise, the whole school gets to see it. We take videos of that. And then Hope very much believes in instilling pride in learning, and we do that via our student goals that's based on the data that we do monitor. Our student-led conferences, we've been doing those for a very, very long time, and we just feel like we get better and better. Sometimes when you do something over and over again, sometimes it can be like, been there, done that, you lose your enthusiasm, and we don't, because we're always looking at how do we make it better, how do we fine-tune it. And then, of course, we've been doing standards-based grading, K through 6 for quite a while now, too. And we just continue to build on those things. And then I call it the COVID shuffle. Our schedules, they're working, you know, shorter, we have less time. We've had to really get creative on how to make this happen, but our learning focus is on ELA and math with a smidgen of science thrown in there too. I don't have a teacher per grade level because we're such a small school, and so we had to change up our multi-age and approach it very differently. So we got very creative on that, on how it is that we're keeping cohorts separate by grade level. We're able to do that with the shortened day. One of our transitions, our Veterans Day celebration, we invite veterans in and the students sing for them, and we weren't able to do that, but we switched it up, and our second graders sung a song and we videoed it, My Country Tis a Bee, and then it was so adorable and how they sound, and we shared that with our parents. And then 65 letters were written by our students. So each student wrote an individual letter to a veteran, and we mailed those off. And so I say that it's the gift that continues, because what's happening is veterans are receiving the letters from our students, and they're emailing someone that they know on staff and saying, I received my letter from so-and-so, please tell them I loved the letter, and they're giving us feedback about what was sent to them. I've also received letters and cards to addressed to me saying thank you so much. I received a letter from this student in 6th grade, and they tell me things like they were never recognized for their service way back when, and they're so proud and so honored and love it that our kids are taking that extra effort. So like on one hand, it was kind of sad for us to go, well, we're not having our normal Veterans Day celebration, and yet what a great silver lining.
Mm-hmm.
We've reached people differently that we've never reached before. So it's incredibly rewarding. Another example of just how we're sharing that, 1st grade, 2nd grade, and 3rd grade. 1st grade did their gobble gobble dance right before Thanksgiving, and 2nd grade did too, and 3rd grade did their own, and the teacher spliced them together, and then we got to share that with our rest of our student body. And so they're still like being able to see their friends in other grades, and it's we really are making the best of the changes that we've had to make, and we're realizing a lot of benefits from that, definitely. I also keep up our Wildcat Facebook page and our Wildcat blog, and so if you don't belong to the Facebook page, you're more than welcome to like us, and then you can see the updates, or you can belong to the blog as well. In closing, I want to say thank you so very much. We love being in school every single day, 5 days a week, face to face with our kiddos. It's incredibly important. They are beaming, they love being there, they are loving learning, they feel really grateful after having that time off in March, April, and May, and part of June, and they are super happy to be back, and we are more than happy to have them back. And like I said, so we've had to change a lot of things, but we've learned a lot, and I mean, I am just eternally grateful for the opportunity. And so with that, I also want to say Merry Christmas and Happy Holidays. Season's greetings, Happy Hanukkah, and Feliz Navidad, and I would have a whole bunch more if I spoke other languages. So thank you.
Thank you very much, Joe.
Thank you.
So I really appreciate the paw prints that I get, the emails, but I don't recall a link to these cute songs. So if I go to the Wildcat,
So the songs,
the Gobble Gobble Dance, whatever
the
that
Gobble
was.
Gobble Dance, I only posted 3rd
Those-
grade. So I'll go
Are those
back
on
and-
Facebook? I can join you on Facebook.
Yeah, you can do that. Those actually, the 2nd grade song for the My Country 'Tis of Thee should be on the Facebook page. The
Oh,
Gobble
okay.
Gobble Dance was sent directly
To
to
the-
parents a link.
That's pretty cute.
Right. And
Well, I think what you're doing is great to
Thank
keep,
you.
to keep everybody feeling.
Like really big comments, of what's going on.
Yeah.
thank you.
And we really appreciate it. And thank you very much for coming up tonight and
You bet.
informing us.
It's my
Any other questions by the board members?
So you have, according to the report here, I see you have 2 current active COVID cases at your
Yes.
school?
So one of them never even came to school. It was something that happened over Thanksgiving vacation and has not been, never even came into school. So that one, they are a student at our school, but they were never there. The other case was a situation where it was a Thanksgiving, but then came to school because it was unbeknownst to them at that
So
point in time.
do you have any students out because of the quarantine requirement?
Yes,
Yeah.
definitely, yes. But a pretty small number. I mean, for the class that was impacted, the number that's out.
Yeah. Good.
Well, thank you very much again.
Thank you.
Super.
Okay, we'll move on to action items, and the first one we have is the consent agenda.
So I'll make a motion that we approve the consent agenda.
I second that.
To move in second that we approve the consent agenda. Any discussion? All those in favor of the motion, please say aye.
Aye.
And that motion is adopted. Next, we have administrative items, COVID-19 update, the plan and the superintendent officer.
Yeah, so I've got some slides up here, and these are mainly just for speaking and so that I can jump back and forth. This is not so much about the pretty presentation as it is a visual for you. So I just want to kind of give you an update and some things to ponder. And I think it's a good meeting for us to be thinking about it. So first of all, I want to do a real quick review of our previous action on COVID. The last time we met, you as a board decided that we would stay in our yellow education plan, which is 5 days a week, on the blended learning schedule, which is the abbreviated day. But also within that meeting, there was given approval so that some increased safety measures, administrative decision-making at each building or department to increase safety measures as needed. And so that was much appreciated. I believe the comment was made is that we don't want to, micromanage those decisions. We would like to leave that to the administration of where you see need. And so each building principal was given that direction. And within each classroom, depending on circumstances, has been also given that information. So thank you for that. So that just is kind of where we are as of today. Okay. So as we continue through here, Bonner County data, and it's going to be of no surprise to anyone that we are seeing an increase. And just a reminder that the Bonner County data that we follow are 7-day rolling average per 100,000 people. And again, remember that when we see these numbers, that is extrapolated out is if we were to have 100,000 people, the percent positivity of people going to get tested, and the hospital capacity at Bonner General Health and regionally. So those are three things we follow. So as of today, you can see what's happened since we've last met. If you look at these dates, we go somewhere in here at Thanksgiving, and we're seeing this spike, and as of today, it is 75.6. So, I think the graphic here tells you what's happening in the community, and I'm sure you're already following that and hear about that. So that is one data. So remember that the number here that the county follows is 30, and we're well above that. And then the percent positivity is still behind a week or so. So, got kicked off there. If I go to laboratory testing, this is the state. You can see that the state as of, what's the date there? The 28th, I believe, was at 18.3. And then I go to the Bonner County. We were at 14.5. And again, remember the cutoff was 20% positivity testing rate, but Panhandle Health had said 14.5 includes a lot of asymptomatic people that are going to get some routine surgeries. That is included in the 14.5. So that's why they felt that, for the people who truly were showing symptoms, it would be above the 14.5%. So I just wanted to keep you updated on that. And I believe as of last night, I think overall Bonner General Health was, through the whole hospital, was at 86% capacity. And as of last night, I believe there were 5 individuals in of their 8. I believe they have 8 hospital, 8 or 9 set up just for COVID.
Yeah.
And I believe there were 5 of those were filled. 3 in the surgical unit and 2 in the ICU. So that kind of gets you up to date on where we are, and kind of the same thing regionally. School district data, as of today, we have 15 active cases. Number of students that are, and staff quarantining is at 66. And if you have an LPOSD link.
So, question, Tom.
Yeah.
Does the 66 include the 15 that are positive, or is that in addition to that?
Good question. I got this from the nurses. I don't know, Gary. I think it might be in addition to the ones that were out that were not tested positive but were considered a close contact. I'm going to make that assumption, but I'm not 100%.
What was he asking if the 15 were part of the 62?
Yeah.
They were in the previous
Okay, then
graphs
they
you gave
probably
us.
are.
The previous graphs you gave us, those were a combination.
Okay.
It was
So that means
incorporated.
there's 51 who are.
So the quarantine.
Who are no longer active. Right.
No, 51 who are
Quarantine.
exposed in quarantine.
Right.
So I'll make this a little bigger. so-
Oh, I was looking at the total cases, 62. Yeah.
Oh, yeah, that's not the total cases. The 62 on this spreadsheet
Mhm.
is the total number of cases that we have had since the
From inception,
beginning
yes.
of September.
Yeah.
Not the number that are currently quarantining because they have been deemed a close contact.
Yeah.
So Gary, it's either 66 in addition to the 15, or the 15 are included in there. I can get that information for you, but I don't have that right now. So you can see, actually, I think we're at 16 now. Things have changed. We did have a non-student late this afternoon that I know of. So we are seeing an uptick in schools, okay? So you get Sandpoint High School has 3 active cases at this point in time. Clark Fork Junior Senior High has 3 active cases. And you know, I do want to let you know that each one of these is a separate story. And that's the hard part about this. It's really, really hard, is that I can tell you the 3 students at Clark Fork High School have never been at Clark Fork High School when they were contagious. It happened over Thanksgiving break, and their parents did the right thing. They did not send them to school, and therefore no other students were impacted, which would be different than the 3 students at Sandpoint High School. So because you say, okay, we had 3 at Clark Fork High School, and you look at their student population, is a much higher
Yeah. Right.
maybe concern or percent positivity than you would be looking out of 950 students at Sandpoint High School.
Sure.
But the difference is that all 3 of these, I believe, were in close contact of a individual outside of school. And so anyway, each one of these stories is just a little bit different. So that's where we are. Do want to mention that community partnership with Kinnicksoo Health Services on COVID testing for anyone who does not have a primary care physician. So we get a lot of phone calls right now, and Panhandle Health is being inundated. They're very, very, very busy, undermanned at this point. So when to get a test, you need to contact your primary care physician. And so what Kinnicksoo Health has done is that if you don't have a primary care physician to get an order, you can contact Kinnicksoo Health. They partnered with Lake Pend School District in the sense that they can order and you can get a test there. So we wanted to make testing available for the people who need it tested.
So is it free, Tom? Can they get the free test?
You know, Gary, I think it's on a sliding scale. You know, so we
I mean,
do
who's
have.
utilizing these 500,000 tests that the
Yeah.
governor's providing
Well,
for all the school districts?
Yeah, it's called a vault test, Gary, and it's a saliva test. We have ordered 120 of those to have available. It's not as so simple because what happens is then it's a home kit that you have to overnight print a label and overnight deliver UPS, and it's a saliva test, and then you've got to mix another part of it in there. And
So it's a kit, it's a
It is a
self-administered
kit,
test.
yeah, and we don't really have the manpower in our nursing department to be setting up as a testing site. We would like to leave, as I said originally, leave the testing to the professionals out in the healthcare community, and that's why it's important for Kinexu to step up here. Now, for staff, if they wanted to try one of those health kits, we could make those available. We haven't got them, the order was just placed, I believe, last Friday. It's called a vault test, and so it sounds good, but it's assuming that you have a lot of staff and that you're just going to drop everything and set up a testing center and start
Right.
testing people, and we're not set up to do that. So again, we would like to keep that to the health professionals as much as we can. So that's kind of where we are with the school district data. Other regional school information, I think, is important for you to just be aware of. I've checked. Coeur d'Alene and Post Falls are still in 4 days a week, 1 day off for remote learning. They don't have a shortened day. So unless something has changed, that was what I got from Panhandle Health. And Boundary, I believe, just went back to 4 days a week. But similar to us, are going to be doing an early release. So that is some other good information for you to have. A little bit of update on vaccinations. And I got this from last Friday afternoon, so something could have changed. K-12 staff, that's not teachers, but all staff, are going to be in a category called 1B. 1A is going to be the first group of people who will be getting the vaccination. And this is going to be, an optional vaccine. We would be in the same group as law enforcement, EMTs, etc. There is no timeline that is definite. Hopefully sometime in January, but that is still changes day to day. This is coming from Panhandle Health information, so I'm relaying this information to you. The total number of vaccines that were going to be available in the state of Idaho has diminished some, and therefore the number of vaccines that would be available to Panhandle Health District in the north has diminished some. So we don't know quite, and also be reminded that anytime you hear the number of doses, you got to divide that in half because
Right.
it's a 2-dose
Right.
shot with 21 days in between.
So 1B is what the school, not the students, but
Not the students.
Staff.
the staff,
Correct.
not the teachers. Right?
No,
No,
teachers would be
teachers are
included
staff,
in that.
yeah.
But I just wanted to say that doesn't mean, it would include bus drivers, food service, so K-12 staff.
Our maintenance, yeah.
With maintenance department, everybody would be in the category 1B.
1B.
But we don't know the availability, and Panhandle Health will be the communication to us of when that becomes available.
Okay.
My hope is, again, and this will be voluntary on staff, not mandatory, but I would hope, I would really be tickled if we could start that in the middle of January, but I don't know that that will happen. Maybe that's too much pie in the sky thinking.
Right.
It could be February, March, don't know. So we still have some time ahead of us, but it is being talked about here. I want to reiterate publicly to you, but also this is really a request to parents and staff, and these are some things that are really, really, really important here. If your student or yourself has symptoms, please stay home. That is extremely important. If someone in your family is pending a COVID test result, please stay home until the results are in. So we run into this case where, I came to school, but my dad was waiting on a test. Yep, and well, the test was positive. And what we're seeing is that in a household, if there's one positive, it's more than likely that there's going to be multiple positives within the same household. Our nursing staff has seen that over and over again. So to be safe, to again keep other students in school, if someone in your family is pending a test, waiting for the results, just stay out until those results come in. If a student tests positive for COVID, please notify the school, okay? That is so helpful. You know, we will get that through Panhandle Health, but it is quicker if we can get it directly from the parents and we have that partnership with the parents. Be diligent with the safety protocols. And I do want to add that I can't emphasize enough, and I did talk about the transportation department, and it's a stressful time. Okay? I'm just going to let you know it is. But it's stressful for all employees in the school setting. Our nursing staff is doing an incredible job, but maybe I'm getting on my soapbox here, but I think this is the time when people need to step up with their best humanity, not their worst, and sometimes we don't see that. So all I'm asking is that, you know, cut some employees some slack a little bit. I mean, it just is important that they understand that everybody's just doing their job, and we all at the school district have one goal, and that is to keep our kids in school and giving them the education. And I'll speak of that in just a little bit. And also a message to the parents that I think they need to have is if we need, and this is not, I get rumors every day, if we need to do a short-term remote learning, you know, parents should be prepared. I don't know what's going to happen with the community data. I don't know if there's going to be a recommendation from Panhandle Health. I don't have any of that information today.
Yeah.
But I'm just saying is that I think it would be short-sighted if we weren't prepared and prepared as a community or prepared as a family for every situation. We all want to see the numbers go back down, but if they don't, and we have to have a short-term, and I say short-term because I'm going to give you some stories here about how important it is to keep kids in school. Families need to be prepared for that. Things for the board to think about. And I want to be, you know, I just want to put a few things out here. Undisputed value for students to be in school. Last Friday, I received 2 emails from 2 different teachers from 2 different schools that were completely unrelated. They did happen to be about the same grade level, though. And I don't want to call them out by name, so I'm going to keep everything a little bit. What they told me was they are receiving some new students that have not been in school this year that are now just starting to come back to school. They did not realize, they did, but they didn't really realize the gains that that the students who have been in school all year have made until they were comparing to the students who are just entering. So when we have some students that are coming into our classroom, you know, and we're talking reading skills, listening skills. Now, I know kids are resilient and our wonderful teachers will get them caught up, and they don't want it to sound, you know, doom and gloom, but just the importance, and as Mrs. Hatley shared with you, the social emotional part of being in. You know, they can't be in the whole school and you don't have the whole pride, but they're in with their cohort. I mean, I can't stress the importance of that. But with that said, we are, you know, it's tough, and we need to, you know, be thinking about some things. And I do want to share with you some. Teacher Association did send out another survey on Friday, and they shared with you about a month ago or so about, you know, what that survey said, and I think it's important that we keep you apprised of this. Interestingly enough, very little changed on their survey. It was about 68% of the respondents said stay the course, stay what we're doing face-to-face. It's working, with 32% feeling that we might need to look at some other adjustments. So that's just some information for you to have. You know, it's about 2/3, 1/3, and that's about where we were at that point in time. And I'm just going to paraphrase, I'm not going to read this to you, but I think it's important. Of those 32, there were some important themes that kind of came out and these were just kind of captured. Largely looking for maybe a temporary solution as the community numbers begin to go up. They're not looking for any permanent change, but rather a change to give the community a chance to get the numbers under control. Concerned about holiday spikes. Mainly at the secondary level, we are starting to see more students taking the remote learning option. They're more apt to be able to stay home. So we're starting to see some more families choosing that. Now I can look at that two ways. Number one, that's just reduced your class sizes. So that says our yellow plan worked for social distancing because now you have fewer kids. I know that every dedicated teacher is looking at that, and we know that it is much more difficult to stay up with your studies, to stay disciplined, and to persevere in a routine if you're not having that teacher guide you through the learning. So that's some information that I wanted to share with you. And again, we're working hard. I've talked to the principals about keeping up with our safety rules within each school. That includes our staff and our students. So those are just a few things that of that survey. When do we pause school based on the community spread data? I don't have a recommendation for you, don't have an answer. I said these are things to think about. And I did reach out to Panhandle Health, trying to get some guidance to help you with the decision of saying, how do we take our school data that we have and extrapolate that to compare it to our community data? And overall, you've heard nationally, you've heard statewide that the recommendations from the health professionals is that kids need to stay in school whenever possible, okay? And that we are probably all agree in the value of that. But again, how do we look at that? And remember, the flexibility of our plan is if we had a very big outbreak in an individual school, we could do remote learning school by school. It may not have to be a whole district going in that direction, unless you as a board, Panhandle Health, health community, we're saying, we need to look at that a little differently. So those are a few things to look at. Talked about school attendance, and then the last thing that I do want to bring up to you is some new CDC guidelines on close contact quarantine has been probably, I know has been brought to your attention. You do have a handout with that. And what I did on that was tell you what our current language is and what a new language may include. Now, I did get an email right before the board meeting from Panhandle Health, again, putting this out there. So this is endorsed by the CDC. Panhandle Health believes that the gold standard is still 14 days of quarantining if you were deemed a close contact. But they recognize the difficulty of that at times, and it is very, very explicit that the 10 days quarantining without testing is only for asymptomatic individuals.
Yeah, Tom, can I say that
Yeah.
I know there's some confusion about terminology based on one letter read tonight. I think some people don't understand the difference. Quarantine, and this is on the CDC site, quarantine is keeping someone who might have been exposed to the virus away from others
Right.
for the protection of the others.
Right.
Isolation is when you have been infected and you're staying home.
Correct.
These are not, we're not talking about quarantining people who have it. We're talking about quarantine is for those who've been exposed
Right.
in their cohort or whatever. Isolation is something different, so.
Correct. Isolation is when you're tested positive, you
Yes.
have to isolate for 10 days from the point
And
that
that's
you're positive
not being
test.
discussed
That
right
is
now.
not being discussed. This is
Just
for
making it-
only quarantining if you have been deemed a close contact.
Yeah.
And I know you have received emails, and I have received emails, and there are people, and we heard letters tonight of, we've got healthy students who are not showing any symptoms or asymptomatic, and are deemed a close contact, therefore, but if they don't show any symptoms and no additional exposure, that means they're not living in a home with somebody who is positive, and have been, face coverings are worn. The quarantine can end on day 10 without testing. On day 7, after receiving a negative PCR COVID test result, with the testing taken at least after day 5. So they say that it has to be, CDC says 48 hours prior to ending that. What just came to me is that on the tail end of that, it's between a 1% error, 1 to maybe an 8% error. It's not 50% or 30%. It's a small percentage that they put out in that. So this is for you to consider based off of emails or input that you have for discussion of whether or not you would want to adopt the new CDC guidelines. And then I would also entertain any other questions you have about what I presented tonight, and or where we are with numbers, and where we are with...
Well, let me just say this. We have Christmas vacation coming up. We have a little over a week into that. We have a new year coming up. So I think that's when we're going to have to get together and see what the effect of the vacation, everybody being home and coming back to school, and reevaluate it then. I think taking a look at it now, I mean, it's fine, but I think it's kind of academic. Let's wait for where there may be real changes and real something to do. Yeah, Gary?
I have a question and a comment. So my question is, do we, in our contact tracing, have we found any cases of student-to-student spread at school?
We maybe. We
It's hard
thought
to
there
say.
was either a student to staff member or a staff member to student in a specialized program, because a staff member tested positive, but just when we thought we made that connection, there was a staff member who had another individual in the household who had tested positive because they were a close contact from outside.
Oh.
So the answer is maybe,
Maybe.
but
Hard to
I
know.
can't rule that out,
One at the
Gary.
most.
It's not,
It's rare.
So-
we're not,
So,
And again,
that goes to my comment.
Yeah.
The Spokane newspaper, the Spokesman Review did a feature this morning. I don't know if any of you read it, but it was a front page feature on education and COVID, and it focused on the public school districts in North Idaho, especially the Lakeland School District. And I just like to cite some of the statistics the reporter used, as a benchmark of where we are. The Lakeland School District, which is marginally larger than us, has had 150 cases. We've had 65. They've had over twice as many as us. Coeur d'Alene, which is 3 times our size, over 11,000 students, has had 330 cases. Still an infection level of 3 times, or twice ours, over twice ours. So I agree with the chair. We've got a plan. It's working. We have some flexibility. We've already made some adjustments to it. I don't see any reason right now to make any changes.
And I would say if we have 2/3 of our teachers are very happy with what's going on and like it, I mean, that's a large percentage. I mean, that's not like, it's a majority. And yes, okay, you may have 1/3 of teachers that have some question about this or that. But, that you're going to have a certain amount of people like that no matter what. So I think we're doing very well. I think it's being what we're doing is well accepted by the teachers and by the staff.
So if I could ask a
But
clarifying.
I do think there's things we need to be aware of as you presented, and things to think about, so I'm not. Yes, Joe?
Chairman, if I could ask a
Yeah, go
clarifying
ahead.
question. Are we talking about the new CDC guidelines, or are we talking about changing any school programming? Or is it all combined into one?
My combined, it's just adjustments, period,
So I have a question. Separating out the two conversations, I don't want to change our level and our 5 day a week. I'm not discussing that at all. I'm just wanting to talk about the topic you brought up recently, the CDC guidelines.
Right.
The last conversation in the whole COVID conversation. We are going to Christmas break. The next in-school day for students is January 4th, and we don't meet again until the 12th, which is the Tuesday after that. So if we are going to have a conversation about looking at these new CDC guidelines, I believe it makes more sense to have the conversation today rather than
Well, we don't know.
after we're back in school.
No, well, we don't know what the situation will be in the schools until the
Well,
late January.
Carrie, I
probably.
give you a lot of,
So,
day to day, we don't know what the situation is going to be. I give you that. That is definitely moving target.
yeah. But discussing it now, thinking we know what it's, we don't know what it's gonna be until the kids come back to school and they've been there a week or two, and we really get a handle on what's going on.
I think that's more relevant to talking about moving between green, yellow, and red.
Right.
I don't think that is relevant to discussing the new CDC guidelines.
Where you at, Carly?
Does that make sense? I agree with you in context of our level. I don't see it has the same kind of relevance as discussing the CDC guidelines. I think the CDC guidelines are not so much as is what we're doing at level yellow working. It has nothing to do with that really. We agree that being in the yellow level seems to be a good position for our district and our schools. The guidelines is more about when our students have been exposed in a cohort classroom, is it acceptable to go to this little bit
More generous, softer,
a little easier quarantine rules that the CDC has come out with? So that's a kind of different conversation. Our spikes in our
And
schools
I'm
that may
all for
happen.
that.
Yeah.
And we're assuming the situation is gonna be more or less the same.
It-
I mean, I think the more we can relax it, the better it is, better off we are.
That's what I
Our
agree.
goal, everybody here agrees and has since day one that we want kids in school.
Yeah.
We want kids in school. We have no evidence of student to student or student to staff trace infection. So I agree with Geraldine. I would support, adopting these new CDC recommendations now.
I kind of cut you off, Pearlie. I don't know if you were taking a breath to talk.
No, that's fine. That's fine.
Well-
Are these really, is this really a change? Didn't we already go to a 10-day?
No, we're
We
at
changed it,
14.
we did change it before, but this
Yeah.
is a little bit different than that.
Yeah, well, with the 7
Right.
in there for positive,
Our
a
nine-
negative
No,
test.
it's 10 with
test.
testing. So this
Yeah.
would be 10 without testing or 7 with testing.
That's the main
And
difference.
it's,
Yeah,
but we discussed that before. If they got a test in the day 5 through 8,
Right.
then they could come back. So we've already discussed that.
But we chose to go to 9
Right.
days with the test
Okay.
instead of, if they went and got a
Correct.
test and it was negative on day 5, then they could come back after day 7
The-
and not 9.
Yeah.
Versus-
Right.
Or without a test and they are no symptoms,
Yeah.
I mean, there's some pretty strict
Along
guidelines there.
along with
difference-
the no contact at home and
Right.
and all that.
And the
yes.
difference is it would be going from 14 days to 10 without testing. Am I right? If I'm reading this language correctly.
As
And
long
then,
as the other criteria were.
as long as they've met
Right.
those other criteria.
Yeah.
And the possibility of 7 days if they did get the test within that time frame after day 5, rather than 9. So we are talking about shifting that quarantine phase, the time they have to be quarantined, a little bit.
Giving them some options. I mean, they can still stay out 10 days if they don't want to get a test. If they do want to get a test, they can come back, and they're negative, they can come back earlier.
They can even stay out longer if they prefer the 14.
Gold
but-
standard was told to me is
Still
still
14.
14.
per scientist.
Well,
Well,
given the light to zero cohort spread within class groups, I'm inclined to want to go lighter on our quarantine length of time.
I agree.
yeah, I think we all agree on that.
Yes.
So let's do it.
Absolutely.
So I would like to make a motion to replace the current language regarding the quarantine with the proposed language that has been presented to us.
I second that.
Okay, I need to make a motion, we really need to nail it down a little bit more. What's the motion?
Okay, so I made a motion to replace the current language as it stands with the proposed language as it's been presented.
Read the whole thing, Joe.
And the present, okay, yeah, we need to maybe read what the new
Read the whole thing.
regulations will be.
Okay, without having, without having the current and the proposed right in front of somebody, it's going to be difficult, so I'm going to read this. The CDC now recommends 2 additional options for how long quarantine should last. Based on local availability of viral testing for people without symptoms, no additional exposure, and face coverings worn, quarantine can end on day 10 without testing, or on day 7 after receiving a negative PCR COVID test result, with the test being taken at least after day 5 of the close contact. After stopping quarantine, people should watch for symptoms until 14 days after exposure. If they have symptoms, immediately self-isolate and contact their local public health authority or healthcare provider. And third, wear a face covering, stay at least 6 feet from others, wash hands, avoid crowds, and take other steps to prevent the spread of COVID-19.
Any questions on the motion? Is that a second?
I'd just like to second that.
Okay.
Yeah.
Then move to second that we make those changes as was read into the record. Any discussion?
Get the kids back in school as soon as possible.
Yeah, exactly.
It helps with that.
All those in favor of the motion, please say aye.
Aye.
Aye. That motion is adopted. Okay, thank you.
So Chair Kelly, can I bring one more thing up?
Sure.
In the things that I said for the board to think about.
Yes.
Okay, and you brought up a very good point that we have the Christmas break coming up. We've got Christmas, New Year's, and we don't know what that spike is. I would just ask that the board entertain the idea that we could meet for a special meeting if need be to determine
Absolutely.
if we need to pause education. It's hard for me to even say those words because I know how important it is for kids to be in school, but
That's
also
why I was asking what our start date was.
we need to really look at the data, what's happening in our community, and as partners with the healthcare professionals in our community, I still believe we've done an excellent job in our schools. I think that it's the safest place for kids to be, but at the same time is that we have to look at the health of our staff, and there's a lot of factors involved there in making sure, because there's a lot of moving parts in the school district. And if we do not have, if we have too many positivities in a school with staff and or a department, that may disrupt, and we may have to put school, either a school on pause or the district on pause. That's not anything that
Hey, why don't we have a meeting on that Friday before school resumes? Early in the morning.
Shirley, how?
Do you guys know the date? It's January 1st.
Yeah,
I'm kidding.
Tom, we've been talking about this all along for months,
Yeah.
about having these contingencies. We agree with you. I mean, we're beating it to death.
I just know that I'm meeting and communicate with a lot of staff members, and I respect them so much, and I also want them to be feeling comfortable. And overwhelmingly, they're so excited the kids are in school and they love what they're doing. But there's also, I just need to be letting you know, there is a level of anxiety as
Yeah.
you see what's happening in the community. So I just think, I just appreciate you as a board, and I appreciate just being ready to, for us to keep an eye on that, and I will keep you updated on things as need be. So,
Yeah, thank you, Tom. I mean,
Okay.
we all know that there's
Yeah.
a pandemic, that it's accelerating, that it's dangerous, and that it's changing daily. So we're all monitoring these sites and listening to getting your emails, and are prepared to meet at close.
Yeah.
Yep.
Hopefully not late on New Year's Eve or early on New Year's Day. That'd be ill-advised.
Okay, let's move on to the next item, and that's the second reading of policy on human resources specialist. Kelly Fisher will give us this.
Good evening. Our senior human resource specialist, Jen Capodine, could not be here this evening, but we both presented at the last regular board meeting 3 policies, 2 just revisions, and 1 new policy for you. And you didn't have any questions regarding those.
Nope.
So
Nope.
if you do, I
So,
will answer any that you have at this time.
so since it's second reading of them and we've looked over them, are you open to entertaining a motion to accept those?
Can we do that all at once, or do you need it?
Two different.
One's a new one, too.
The revisions
Yes.
can be together in the new one.
Correct.
So I would make a motion that we would accept the policies 5240, sexual harassment, sexual intimidation in the workplace, and 5250, grievances, as revised.
Second.
To move the second that we approve the revision of the 2 statutes that were read into the record, 5240 sexual harassment and 5250 grievances. Any discussion at all? All those in favor of the motion, please say aye.
Aye.
That motion is adopted.
And so I'd make a motion that we accept the new policy 5620, safety management program and district personnel, as presented.
I second.
To move the second that we approve a new policy, 5620, safety management program, district personnel. Any discussion on that? All those in favor of the motion, please say aye.
Aye.
That motion carries. And now we're down to announcements. So, Superintendent, do you have
I think
announcements?
I've talked a lot tonight, so I would
Oh.
entertain the audience here.
You're going to pass? Yes.
We are happy to report at Sandpoint High School that we had another senior who was selected as a Quest Bridge Scholar and got a complete match to Grinnell College. And his
Oh,
name is
wow.
Dylan Rollins, and hopefully we'll be getting an article out in the paper. So it's super exciting for
That is
him.
great.
Yeah.
And it's a wonderful, wonderful program that Quest Bridge does, and he is a match, and so he will be able to go to Grinnell for really a very, 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 very nominal fee for
Oh, that's wonderful.
all 4 years, so it's
That is
exciting.
wonderful.
Super.
Grinnell, it's a great place.
Yeah,
So that's in Iowa?
It's an hour, yeah.
yep. But it was his 3rd match, and he got one of his top 3, and he got his match, so.
Great.
Wow, that's awesome. That's
Yeah.
awesome. I know you've been working hard on those.
Gary was with us when we first started it and learned about it, but yeah, so that's our second student that's actually gotten a full match, so that's
Good.
an exciting.
Congratulations.
Thank you. Principal Hadley, do you have any departing words for us?
Just thank you very much for everything.
Well, with the holidays coming up, I want to wish the board, everybody, happy holidays and
Merry Christmas.
all of you, your staff.
So I have a question.
Yes.
You gave us a report on the SAT scores. Do you want to talk about that, or should we wait to have Mr.
I'd
Miles
like
talk?
to save for Mr. Miles to do that. He wanted me to pass that on early. He doesn't present to you till May, if you have any specific questions. But he is Sandpoint High School is very proud. I believe those were the senior scores, right?
Yeah.
So remember last year, yeah. And so they did very well.
So,
Okay.
thank you.
No further business, we'll stand adjourned. Thank you very much, board.